Thank you everyone for tuning in to this video in our series about the COVID-19 virus in Vermont. Today, I'm pleased to have with me Dr. Rebecca Bell. She's a pediatric critical care physician and is the president of the Vermont chapter of American Academy of Pediatrics. She's with us today to talk about community immunity and herd immunity and how to protect our most vulnerable, which is really critical at all times, and particularly in this moment. So thank you for joining me today, Dr. Bell.
I'm really pleased to be here, and I really appreciate you taking the time to have this conversation.
From what I understand, as we move forward, we obviously don't know if there's going to be a specific day when the danger is gone until really there's a vaccine or a serology test that tells us we have a super high rate of inoculation naturally, which is just not likely right now. And the vaccine is really in the early stages of development. Can you tell us a little bit about what you understand about either the timeline of a vaccine and or what we can do in the meantime to figure out how to find a balance between full lockdown or stay home, stay safe, which was a nice term for basically locking down, and when we have vaccine and full herd immunity?
There are a lot of questions about vaccines. So first you hit on what's the timeline. And we don't really know yet. And we know that with the H1N1 epidemic, that vaccine took 6 months to get into production, even though we already had a flu vaccine in place. So we suspect that this vaccine for the novel coronavirus is going to take quite some time, so much longer than that, perhaps a year or more. Then the next question is, how will it provide immunity? And to what populations will it provide immunity? So we don't expect it's going to be, unfortunately, a vaccine like the measles vaccine, where you get it, it's very effective, and you're immune to measles after that. Likely this is going to be something closer to the flu vaccine, we think, where it may only provide immunity for a temporary amount of time. And then the question is, who does it work well in? And some scientists are thinking that perhaps it might not provide great immunity to older folks, and it may be more younger folks who, when they get vaccinated, it produces a robust immunity, and not so much in older folks. So there's a lot of questions around vaccines right now. And what we're seeing right now is this really extreme example of what happens when we don't have herd immunity or community immunity. So when we think about, say, the flu vaccine and the flu season, every year, all the healthcare workers who are at risk of taking care of people with the flu, we all get vaccinated. We really make sure our vulnerable populations get vaccinated. So older folks who are immune compromised, and then young kids. And we wish we could do that right now, but we can't. I think what's really interesting and really heartening is to see what our response as a community has been to protecting those vulnerable folks, the extreme measures we've had to go to. And I hope that when we come out of this, we're really able to think about how we prevent this from happening in the future, and really look towards our health department as guidance. So our public health workers have really tough jobs, because when an outbreak or an epidemic happens, they have to answer a lot of questions as to why this wasn't prevented. At the same time, when they work towards prevention, when they sort of raise red flags and alarms saying, we're really vulnerable to this, we're really worried about school vaccination rates, for instance, oftentimes people say, well, we're not really seeing any outbreaks. Why are you so worried? There's not a problem. And so I'm hopeful that when we come out of this, that we'll be able to, just as a society, better understand the work of public health officials and why it's so important to prevent this from happening in the first place. And thinking through about how we now as individuals, we all feel so vulnerable to this virus because none of us have immunity. And thinking about how nervous some of us might get going to the grocery store now. And that's how people who are immune compromised might feel all the time. They feel very vulnerable. And so thinking about what we can do to continue to protect the most vulnerable, I do have hope that we're going to come out of this with a lot of empathy and compassion for those who are vulnerable in our community.
We are starting to hear and see different information around the world around natural rates of inoculation, that maybe more people are getting this than are exhibiting symptoms. Maybe that's a good thing in a way, but it's also troubling because folks can be carrying it and shedding virus and nobody knows it, and leading to more fear for those who are vulnerable. Are we learning more about that, or is it too early to tell in terms of the rates of basically natural inoculation with people that aren't showing symptoms?
I think it's too early to really make any definitive declarations on this, but every day we're learning more information, and as scientists and physicians, we are desperate for more data on this. So we want to know who's got the virus, and they're symptomatic, who's got the virus and they're not symptomatic, who develops immunity, and what does that immunity actually mean? So I mentioned before, we don't know with the vaccine how long-term that immunity might be. And that may be similar to those who get the illness and then develop antibodies on their own. How good are those antibodies for, So many viruses we can get over and over and over again. And we suspect that this novel coronavirus will be the same. We don't suspect that you'll get it and then become immune forever, but we don't really know. And so this is going to need to be a timeline where we follow rates of infection, we follow rates of who's got the virus, and then who develops antibodies, but then do they get sick again with this over time? And what does that timeline look like? And then we can really paint a picture as to how we can move about in society. Like right now, we're a little bit in the dark because we really don't have a good sense of what is the natural course of this? What does natural immunity look like? What does vaccine immunity look like? We're gathering more and more data. And I will say also as a physician, what has been really remarkable these last few weeks is the amount of global cooperation among scientists and researchers and public health officials and people sharing all kinds of information. I think it's important for us to understand that a lot of this data is preliminary. A lot of it's anecdotal, and so we don't want to make sweeping generalizations, but the amount of sharing and cooperation and collaboration that's going on is really heartening.
I actually just spatially appropriately saw a neighbor who is a retired immunologist who said he was on a 1,000-person immunologist conference around the world on this topic. And so I think that reflects on what you were just talking about. And the scientific community, I think, thankfully doesn't get into the world of the political community that some of us are in terms of who wins and who loses politically. It sounds like your work is about, everybody winning through better public health. And I appreciate your work in that regard, not only around COVID-19, but around children's health in general, which is, your area and your role as president of the Academy. So thank you for that.